Hello, my name is Dr. Kristen Higgins, and I'm a radiation oncologist specializing in thoracic cancers at Winship Cancer Institute of Emory University. For patients that receive the traditional form of radiation for lung cancer, which is conventionally fractionated radiation, typically given over the course of 6 weeks, the side effects are also manageable, but we can go over them a little bit more thoroughly. Fatigue is a universal side effect of radiation. Keeping up with fluids can help with that fatigue that the radiation causes. Much of that fatigue can be driven by dehydration, so that's why the fluid intake is really important. One of the main side effects that patients will develop during fractionated radiation for lung cancer is inflammation of the esophagus. And that typically manifests as chest pain or sometimes heartburn-like symptoms. We give medicines to help with that. Many of our patients take proton pump inhibitors to reduce their own naturally occurring acid reflux that can exacerbate the inflammation of the esophagus during radiation. The esophageal inflammation typically resolves pretty quickly after the radiation course is complete. Usually around 10 days after radiation is finished, the esophagus is just about healed up. The esophagitis is typically not severe enough to warrant any sort of PEG tube placement or any sort of need for additional nutritional support. We're generally able to get all of our patients through the treatment without the need for additional nutritional support. Occasionally, we do supplement with IV fluids, which can be really helpful in terms of just the way that the patients feel. Sometimes it's hard to get down the adequate amount of fluids during that course of radiation when the esophagus is really causing a lot of pain. So I do use IV fluids quite frequently to help my patients through the treatment, especially the last 2 weeks when you would expect the esophagitis to be peaking. Other side effects can be inflammation of the lung. That typically will develop after radiation is finished. Patients will sometimes have a dry cough and increasing shortness of breath, and that can indicate that the lung is developing inflammation from radiation. Occasionally, we have to treat that with high-dose steroids if it is severe enough, but it typically will resolve with adequate and prompt treatment. And I think those are the main side effects that our patients experience from fractionated radiation therapy. Lastly, one long-term side effect that we know our patients are at risk for is development of cardiac side effects from radiation. And that can be things like a heart attack or accelerated atherosclerosis in the coronary arteries, sometimes arrhythmias, or valvular disorders after radiation. We are very careful to protect the heart when we're designing our radiation plans. And there's a lot of research going on right now in our field in terms of how we can optimize the way that we deliver radiation to protect the heart and the vessels as much as we can to prevent those cardiac events down the road.